towards nuclear medicine equipment. In this video, we will look into cobalt-60 radiation therapy instruments. Let's learn about where it all began. In 1949, Dr. Harold E. Johns of the University of Saskatchewan sent a request to the National Research Council, or NRC, of Canada, asking it to produce cobalt-60 isotopes for use in a cobalt therapy unit prototype. Two cobalt-60 apparatuses were then built, one in Saskatoon in the cancer wing of the University of Saskatchewan and the other in London, Ontario. Dr. Johns collected depth dose data at the University of Saskatchewan, which would later become the world standard. The first person to be treated with cobalt-60 radiation was treated on October 27, 1951, at the War Memorial Children's Hospital in London, Ontario. In 1961, cobalt therapy was expected to replace X-ray radiotherapy. In 1966, Walt Disney's lung cancer was treated with this procedure, but could not prevent his death. Let's look into the workings of a typical CO machine. The source is mechanically pushed along a long tube surrounded by a thick block of lead towards the on position, at which point no one except the patient is allowed to enter the treatment room. After the exposure, the source must go back to its off position where it may get stuck. One or more of the staff must then enter to deal with the problem, pushing the capsule manually with a rod 100 centimeters long prepared for this purpose. The radiation beam is defined by a manually adjustable slope-sided collimator assembly. This collimator uses a fixed rectangular field to be obtained. Point detector techniques and F5 tally are used to calculate the gamma ray's flux at different points in the path, and the ANS photon flux-to-dose conversion factor are used to determine the dose rate. 10 million photon histories are used to accumulate the tallies, which are normalized to the cobalt source. The statistical uncertain ties of the results range between 1 to 3% for all tally values. The simulation time for each calculation point is approximately 1 to 2 hours at computer platform PC 1700 MHz. The point detector technique usually consumes a lot of computer time, but also achieves a better precision. A default cross-section library is used for photon tally, and the code reads the cross-section automatically from the photon cross-section library, MCPLIB22. The cobalt-60 source emits 2 photons per disintegration with energies of 1.333 and 1.17 MeV. Animation shows a two-dimensional plane of the described model as given by MCNP4B in an irradiation position, where the source appears inside the tungsten shield surrounded by a thick shield of lead. The scenario of the accident was drawn up according to an experimental study which illustrated an experimental model of radiation dose measurements for occupational personnel during a source stuck. A PDM, portable dosimeter, and Kodiak radiation monitoring films were fixed on a rando Phantom. Let's look into the application of cobalt-60 radiation therapy. Cobalt-60, or 60CO, is often the ideal mode of radiation for treating laryngeal cancer. For primary treatment of laryngeal cancer, 60CO allows adequate dosing of the superficial tissues. Historically, great concern has been expressed that 6 MeV photons have too large a buildup region and can potentially underdo superficial tissues. Most radiation oncology centers only have linear accelerators. If a 60CO unit is not available, 4 MeV photon beams are adequate. However, the lowest energy of units at many centers is 6 MeV photons. Even so, reviews of experiences with 6 MeV photons indicate that control rates for early lesions remain high, and use of this higher energy does not compromise treatment. A dosimetric comparison of 60CO and 6 MeV beams conducted at the University of Florida led the investigators to conclude that the dose distribution for the two beams was similar except for most anterior tissues 3 mm below the surface, where underdosing occurred with the 6 MeV beam. On the basis of their results, the investigators cautioned against using 6 MeV beams for lesions in the anterior commissure. This was the simplified video on cobalt-60 radiation instruments. I hope you liked it, and if you did, please give us a thumbs up and subscribe to this channel.